Next, you will make and record 2 facial and 2 intraoral measurements that will be used by AvaDent to design your WTI. You'll make these measurements using a device we call an Avameter, a device specifically designed for this purpose. The first and most important measurement in the protocol is the IP, or incisive papilla measurement. You will record the distance from the patient's incisive papilla to the edge of the patient's resting lip. In the dentate patient, the incisive papilla sits directly behind the maxillary central incisors and is positioned approximately 8 to 10 millimeters behind the labial surface of the central incisors as well. In most instances, the incisal edge of the maxillary central incisors are directly behind the edge of the resting upper lip when a person is in repose. In the edentulous state, things change. The incisive papilla rises vertically as the alveolar bone of the anterior maxilla resorbs, but fortunately, the incisive papilla moves very little in a posterior direction. This allows us to roughly position the incisal edge of the WTI central incisors at a position that closely approximates the patient's natural teeth. To make this measurement, seat the patient upright. Place the cupped edge of the Avameter onto the patient's incisive papilla. The instrument should be positioned parallel to the patient's facial midline. Ask the patient to relax his or her lip. This may take coaching with some patients. Record the length of the upper lip in millimeters. Measurements may slightly vary from clinician to clinician. In many offices, various clinical staff members are asked to make this same measurement. The numbers are compared and a consensus determined. Then, ask the patient to smile. Record the distance from the incisive papilla to the shortened edge of the upper lip. This measurement gives the AvaDent technicians some sense of tooth exposure when the lips are animated. Next, measure the width of the patient's nasal ala. This number will be used by AvaDent to approximate the position of the canines in the initial WTI setup. Finally, use the Papillameter to measure the interpupillary width. This measurement can be combined with photos supplied by the patient to determine the size and form of the patient's natural maxillary anterior teeth. Record these numbers and supply them to the laboratory for use as they fabricate your WTI.